Someone feels strange tingling in their hands and feet, and they blame it on tiredness. What people don't realize is that these quiet beginnings often turn into slow-building mysteries inside the body. And that's exactly why vitamins like D3, A, B6, B3, and E are among the most commonly misdosed. But when you look closer, you realize a pattern.
This video is made for educational and informational purposes only.
It usually starts quietly, almost too quietly to notice. Someone wakes up feeling a little more tired than usual. Someone else has been taking an extra supplement for immunity because a friend recommended it. Another person adds a new multivitamin on top of the one they already take because the label looks harmless and the bottle says supports energy and bone health. No alarms go off, no traumatic symptoms, just small things you brush aside. That's how most vitamin mistakes begin, not with panic, but with confidence. The kind of confidence that makes you believe, they're vitamins, what's the worst that could happen? What people don't realize is that these quiet beginnings often turn into slow-building mysteries inside the body. A little extra vitamin D here, a high-potency B6 capsule there, a skin supplement with vitamin A mixed in, and suddenly your system is juggling more nutrients than it knows what to do with. The irony is almost painful. The very pills meant to protect you start creating problems that are so subtle, so gradual, that you don't see the connection until you're already deep inside the puzzle. Somewhere along the way, someone feels strange tingling in their hands and feet, and they blame it on tiredness. Another person gets nauseous after meals and thinks it's acidity. Someone else starts experiencing headaches or blurry vision and shrugs it off as stress. No one suspects vitamins. Why would they? They're supposed to be the good guys. And that's exactly why vitamins like D3, A, B6, B3, and E are among the most commonly misdosed. They're popular, widely praised, recommended in every second YouTube video, and they sound safe. But when you look closer, you realize a pattern. The more loved a vitamin is, the easier it becomes to overdo it without meaning to. Take vitamin D3, for instance. People hear it's great for immunity and bones, and suddenly they're taking 2,000, 5,000, even 10,000 IU daily without consulting a healthcare provider or any test to confirm a deficiency. Slowly, calcium levels creep up in the blood. Someone feels nauseous. Someone gets thirsty all the time. Someone's kidneys start working overtime. It's never obvious at first, but the signs are there, quietly stacking up. Or vitamin A. The moment someone buys a glowing skin supplement or a vision support combo, they don't realize vitamin A is hiding inside, ready to build up in their liver. One extra capsule every day doesn't sound like much, yet over time it can lead to headaches, dizziness, liver stress, and in more serious cases, liver-related complications that may require medical attention. Pregnant women don't even realize that high levels of vitamin A during pregnancy may pose risks to fetal development. Then there's vitamin B6, the hero for mood and energy. People take it thinking it'll keep them sharp and upbeat, not knowing that long-term high doses may be associated with peripheral nerve-related symptoms. Numbness in the feet, weird tingling sensations, an odd feeling like walking on soft rubber. These symptoms creep in so slowly that most people don't link them to the cheerful yellow pill they've been swallowing every morning. B3 or niacin is another tricky one. Some take it for cholesterol because someone online said it's natural. But natural doesn't mean harmless. High doses push the liver to its limits, cause sudden flushing, digestive discomfort, or deep abdominal pain. People think they're having an allergic reaction or gastric issue, when in reality, the high-dose niacin they've been taking unsupervised may be contributing to those symptoms. Even vitamin E, the famous antioxidant, isn't innocent. It slides into hair oils, capsules, skincare gummies, fortified foods, you name it. But too much interferes with blood clotting. Someone cuts their finger and wonders why it's bleeding longer than usual. Someone on blood thinners doesn't realize they're now at higher risk of bleeding because of a simple antioxidant supplement they added. Again, nothing screams danger. It's all quiet, gradual, and convincing enough to ignore. part of the confusion comes from how vitamins behave in the body. Water-soluble ones like vitamin C and the B group dissolve in water and usually flush out through urine. That gives people a false sense of safety. They think more is fine because the body will throw out what it doesn't need. And yes, that's partly true, but only partly. Even water-soluble vitamins have limits. Too much B6 over time can damage nerves. High doses of niacin can injure the liver or cause harsh flushing. Even vitamin C, everyone's favorite, can create stomach cramps, diarrhea, nausea, and in some individuals, headaches or other discomfort when taken in very high amounts. The body protects you to an extent, but push it too far and those protections crack. Fat-soluble vitamins are the real slow-burn troublemakers. A little extra doesn't leave the body. Instead, it tucks itself away in your liver and fat tissues, day after day, week after week. Vitamin A, D, E, and K don't rush out. They linger, pile up, and quietly wait until the symptoms finally show. A mild headache becomes a persistent one. A bit of nausea becomes daily discomfort. Bones ache, fatigue creeps in, heartbeat feels off, skin looks irritated, or pressure builds in the skull. Everything feels scattered and random, but the truth sits in the background, a vitamin overdose you never saw coming. This is why doctors rely on blood test reference ranges, not because the numbers look scientific, but because your body works within certain limits. Vitamin D3 usually sits between 20 and 50 ng per ml for most people, though some labs say 30 to 100. Vitamin A sits between 20 and 60 mcg per dl. B6 stays between 5 and 50 ng per ml. Vitamin E usually falls between 5.5 and 17 milligrams per liter. Vitamin B12 lives between 200 and 900 pg per ml. These ranges tell a story. Too low and your body struggles. Too high and your body signals distress in ways you don't always recognize. And yet, people keep guessing. They take supplements based on what their cousin takes, what an influencer claims, or whatever their favorite bottle says. But the truth is, no two bodies are the same. The dose someone else needs might be too much or too little for you. Your ideal intake depends on your age, diet, gut absorption, medical conditions, and whether you're truly deficient in the first place. The problem isn't vitamins, it's assuming your body needs something without checking. This is where blood tests come in. A simple 25-OHD test for vitamin D tells you if your fatigue is actually a deficiency. A serum B12 test explains tingling or memory fog. Iron tests like ferritin and TIBC uncover hidden anemia. Folate levels reveal if mouth sores or concentration issues are linked to nutrition. Serum magnesium can explain muscle cramps or heart rhythm changes. Calcium levels show if your bones or nerves are under stress. Zinc tests uncover hair loss or slow wound healing. Omega-3 testing points to inflammation or dry skin. Iodine tests reveal thyroid-related fatigue or weight gain. Each of these numbers acts like a clue in your health mystery, helping you stop guessing and start understanding. Avoiding vitamin misdosing doesn't require fear, it just needs awareness. Instead of assuming more is better, consider that your body might be whispering hints you haven't paid attention to. Talk to a doctor before starting anything new. Avoid megadoses unless they're prescribed. Keep track of what you take, especially if your supplements overlap. Notice if your foods are fortified. Read labels. Check your percent daily values. Reassess every few months because your needs change as you move through different phases of life. In the end, the mystery isn't meant to scare you. It's meant to wake you up to how something so small, a capsule, a tablet, a gummy, can change the way your body feels without warning. The safest path is the personalized one. Test, track, and tailor your choices. The supplements in your drawer aren't villains, but they're not harmless sidekicks either. They're tools, and tools only work when you know exactly how to use them.
This video is for educational and informational purposes only and does not constitute medical advice. Always seek the advice of a qualified healthcare provider regarding any medical condition or treatment.